Hey everyone, it's Dr. J with Dental Masters here in Alexandria, and today we're going to talk about some of the objections or really hesitations that I hear often when it pertains to patients moving forward with either implant treatment or really any type of treatment in general. So let's go ahead and dive into it. So let's talk about time. I hear this quite a bit. I don't have enough time in my schedule, doc, to get my dental implant or my tooth fixed. And it could be your kids, it could be your work schedule. We all have that, multiple meetings. And bottom line is we all have these things going on, and the fact is you don't have the time to not get it done. And here's why. Because if you have a tooth that's unhealthy that needs to be taken out for an implant, or if you have a tooth that needs to get a crown to be repaired or restored properly, there's never a good time for that. So you have to make the time. And by the way, not just more time, more money, more resources. So you have to proactively find the time to make these things to take care of yourself. One thing I hear all the time is, let me go ahead and talk to my husband, or let me talk to my wife. And I understand you really should bring them in for that consultation when you do so you don't waste your time, and you can make the right decision on the spot, or at least have both of you can get the information to go home and make the right decision. So if you're making decisions with another person, another family member, go ahead and bring that person in with you to the consultation so you can find out what the risks are, what the benefits are, what the costs are, what the requirements are, and so you can get it done and get yourself taken care of. So let's go ahead and talk about fear. Fear is something that is common in dentistry. Pretty much everyone hates coming to the dentist, whether you're afraid or you just hate it. And let's talk more specifically about fear around the process of getting implants, whether it's a single implant or it's a whole row of teeth. And there's a couple things that people may have fear of. The first one is going to be, is it gonna hurt, doc? Am I gonna have discomfort during the procedure? Am I gonna have pain after the procedure? So let's speak a little bit about that. Making sure that we have proper pain management and keeping you comfortable for the entire procedure is 100% part of what we do. Now, obviously it's a surgery, and I'm not gonna say that there's not gonna be any type of discomfort, or you might not have to put ice on your face, but when you come in, we're gonna make sure that there's no pain during the procedure, whether it's using local anesthetic, making sure that you're good and numb, or even conscious sedation so that you don't really have any awareness of what's going on. Making sure that you're pain-free and comfortable is 100% part of what we do. After the procedure, we're already thinking about post-op pain during the procedure before we even get to the end of the procedure. So we're giving you medications at time of procedure, so they're already starting to take effect. So when your numbing is wearing off, the other medications are starting to work. So you get ahead of the discomfort, or you get ahead of the swelling. This is all part of the process. And having a good consultation and discussion with your doctor, your dentist ahead of time is super important. It's something that we never forget to do. We always have that included, is having a really important sit down and discussion about how we're going to manage your pain, your anxiety, your discomfort, so we can get you through this process in a seamless way with as much comfort, making the best experience possible. Fear of the unknown. This is something else that comes up. What do I mean by that? So many people are concerned about what is the tooth or their teeth going to look like, or what is it going to feel like? Is it a foreign object? Or even what are the dental instruments going to be like going in my mouth? All sorts of things. So these are things that we talk about again on the front end. It's really important, these front end conversations and intake records and workups. Why? So if we want to show you what your teeth are going to look like before we even start the process, we have a really good workflow using digital dentistry and high-tech scanning that we can show you ahead of time. And in fact, you are part of what your teeth are going to look like. You get to become part of that, making that decision. So that takes a little bit of that unknown away as far as what are my teeth going to look like. As far as what is it going to feel like, we're going to be alongside the entire way to guide you through the process. Is there changes that take place from a tooth to an implant? Of course there is, but it's going to be as seamless as possible. And for the most part, every patient that I've worked with has either had a seamless process or they've had a very quick adaptation from their natural tooth to their implant. So that's a really important thing for us to discuss with you so we can make sure that you're comfortable through this process. Okay, let's talk about the big one, the elephant in the room, and that's the cost. So this is definitely one of the biggest concerns or conversations that needs to be had before you get your implant placed. So obviously implants, they're an investment. There is a cost behind them, and there's dental insurance, but for the most part, dental insurance, just so you know, it's not gonna cover the entire process of getting an implant or getting a full row of teeth replaced. So we will always maximize your insurance benefits so we can get as much from that we can if you have insurance, if you have that luxury. But the other thing that's available to you is that there's a lot of different payment plans. We have multiple companies and vendors that we use that can get you into a low cost and sometimes low or no interest rate, depending on what your situation is and what your goals are. Maybe you want to have a lower payment. Maybe you want to have a down payment and have a lower interest rate. There's a lot of different options, is my point, of how we can get the cost and the finances taken care of so you can get the treatment that you need. Because bottom line is, it's not going to get any cheaper. It only gets more expensive as time goes by. You're going to need more treatment or more invasive treatment to get where you need to go to get your smile back so you have confidence. So we got to address the cost. It's important that we talk about this up front and find a way to help you make the investment in your own health and your own confidence and in yourself. So these are some of the major concerns and objections, questions that I get from patients that are looking to move forward with either implant treatment or restorative treatment. And I know for time's sake in this short video, I can't possibly answer all your questions, all the possible concerns, but that's why when you come in for your consultation, we'll sit down face to face and really have a dialogue, a conversation with you and your significant other. We'll look at your medical history, we'll look at your dental history, we'll look at your bone, we'll look at your finances, and really go through each thing that's important to you so that we can get you the treatment that you need. So again, I hope this was helpful. This is Dr. J with Dental Masters. Feel free to drop any questions or concerns you have in comments, and we look forward to seeing you in the future.